everyone, I am Beverly Jane L. Datu, Buaxi, third-year student nurse from NUST, and I'm here to perform or demonstrate how to use NGT or Nasogastric tube by feeding. So what is nasogastric tube? A nasogastric tube or the NGT is a thin, soft tube that goes in through the nose, down to throat, and into the stomach. They're used to feed formula to a child who can get nutrition by mouth. Sometimes, kids get medicine through the tube. NG tubes are used for short periods of time, usually for a few weeks to months. For the assessment, we need to assess the doctor's order, client's level of consciousness and level of knowledge and understanding, availability and functionality of the needed materials, for any signs of clinical malnutrition or dehydration, for allergies to any food in the feeding. If the client is lactose intolerant, check the tube feeding formula, then notify the primary care provider if any incompatibilities exist. For the planning, before commencing a tube feeding, determine the type, amount, and frequency of feeding and intolerance of previous feedings. Prepare equipment such as correct type and amount of feeding solution, 60 ml catheter tip of syringe, emesis basin, clean gloves, pH test strip or meter, large syringe or calibrated plastic feeding bag with label and tubing that can be attached to a feeding tube or pre-filled bottle with a drip chamber, tubing, and a flow regulator clamp. Measuring container from which to pour the feeding if using open system. Water for at least 60 ml unless otherwise specified at the room temperature. Then feeding pump as required. For the implementation, prior to performing the feeding, introduce yourself and verify the client's identity using agency protocol. Explain to the client on what you're going to do, why it is necessary, and how he or she can participate. Inform the client that the feeding should not cause any discomfort but may cause a feeling of fullness. Perform hand hygiene and observe appropriate infection control procedure. Provide privacy for this procedure if the client desires. The tube feeding are embarrassing to some people. Assess tube placement. Apply clean gloves. Attach the syringe to the open end of the tube and aspirate. Check the pH. Allow 1 hour to elapse before testing the pH if the client has received a medication. Use a pH meter rather than a pH paper if the client is receiving a continuous feeding. Follow agency policy if the pH is equal to or greater than 6. Assess residual feeding contents. If the tube is placed in the stomach, aspirate all contents and measure the amount before administering the feeding. Administer the feeding. Before administering feeding, check the expiration date of the feeding. Warm the feeding to room temperature, as the excessive cold feeding may cause abdominal cramps. Clamp the feeding tube. Clamp the feeding tube before all the water is stilled. Clamping prevents air from entering the tube. Ensure that the client comfort and safety. Secure the tubing to the client's gown. This will minimize pulling of the tube, thus preventing discomfort and dislodgement. Ask the client to remain sitting upright in foolish position or in a slightly elevated right lateral position for at least 30 minutes. This position will facilitate the digestion and movement of the feeding from the stomach along the alimentary tract and prevent the potential aspiration of the feeding into the lungs. For the evaluation, Evaluate the patient's response to the procedure. Document the procedure and other important data on the client's chart.